practice, it's made a huge difference in patient satisfaction. There's no question. We just don't have those patients that come in with that pain in their knee, even though everything that you have done seems to be right, and they've done their therapy and they still have difficulty with some pain control. So from my standpoint, patient satisfaction has made a big difference. Our length of stays have gone down exponentially since we started using this knee. Now, whether that is 100% attributable to the knee, I couldn't say, but I would say with 100% certainty that the patients mobilize very quickly, and most patients now are out day of or day after the surgery, and I think that stems from the fact that their knee it doesn't feel like a replaced knee.
I was searching for something that worked a little bit differently and a little bit better, because I thought I had a fair number of outliers consistent with a lot of published reports of 15 or 20 or 25% less than completely satisfied knees. And I was looking for something that didn't work like all the other traditional knees, primarily didn't work on a posterior stabilized or a cruciate retaining concept, which, as I was sort of relearning and restudying my anatomy and trying to figure out how to get a better balance between stability and motion in a total knee, would provide that for me. And I felt like I wasn't getting it with traditional PS or posterior stabilized designs or cruciate retaining designs. And I kind of fell upon the medial pivot that really had a different concept and approached kinematics very differently and in a more modern way, based on some much more recent studies and more recent understanding of how the knee actually moves.
I've had some patients when I was transitioning that had the other type of implants that I used, and then I started using the medial pivot knee. That was a dramatic difference. That's where I learned. The patient testimonials. They came in and told me, look, they look asymmetric. One side is stronger than the other. It wasn't related to dominant side. They also said, look, I am leading with that medial pivot leg. When I go down the stairs, that's my lead leg. And in fact, now when I have patients with medial pivot knee and their natural knee, they start to lead with their medial pivot knee because it's stronger, right or left. That really goes back to saying that we not only got rid of all of the inflammation, but we treated all of the instability, which is causing pain from apprehension.
The medial pivot's become my knee of choice for sure. Overwhelming majority of my patients will get that. The only time I don't use a medial pivot, medial pivot will be if I've maybe done some other type of knee on their other side. But even in those situations now, I'm going more and more towards the medial pivot. You know, early on, the patients seem to recover quicker. And they seem to have a more normal knee in terms of their kinematics. They walk more normally. Certainly a lot of the traditional complaints that knee replacement patients had, medial sided knee pain, sometimes instability, the majority of those have basically disappeared from my practice. On top of it, it's a very technically straightforward and simple operation to do. There's nothing more complex about the operation. I'm doing it essentially the same way I've done it since I was in training.
I started almost 20 years ago in May '98. Until now I performed over 3,500 medial pivots, almost 4,000. I was there from the beginning. I put in the first medial pivot on the European continent. Why did I start it? Because at that time I saw some problems with my total knee replacements. Absolutely, they were good regarding pain, but we saw early failures regarding polywear. We saw that problem with instability. At that time, I was really looking for something new because I was not 100% satisfied. I'm not the only one that always will jump on something new, but I was so convinced that I really did it. And from the first surgeries, I saw already the difference. My patients were really happier. They told me that they really trust their knee. And that was something that I didn't see before, that patients come to me and say, oh, doctor, I have no pain, but I really trust my knee. And that made really me believe that I made the right choice and that I had to continue.